All right, fantastic. So we're live on YouTube, and we're going to start the class. This is OET Speaking. It's a final session today, but I want to just start off by reviewing what did we study this week? What has been the main topic?
Introduction.
Yeah.
Awesome.
And on Monday, I said, there's many different types of introductions, but in general, how many introductions do we have to learn? So
Six.
six. Yeah.
Yeah.
Six. And the reason is, so there's usually 6 introductions. There's more. There's much more actually, but there's 6 introductions that are very common, right? You're gonna probably 90% of the time you're gonna see it'll be one of these. Okay, one of these situations. Just try and keep microphones off as well, guys, so we don't have noise. All right. So we have you might have a home introduction. What else do we need, guys?
Clinic.
Hospital.
And we've got hospital as well. Okay, so people are still joining the class. Clinic and hospital. Okay, but that's only 3. So why do we need to learn 6?
Unknown
It can be
patient.
unknown.
Known patient.
Thank you. So Ronica, if you could just put your microphone on. We have unknown patients and we also have
Known.
known patients. Okay, so sometimes you might be reading the cue card and it says, you saw your patient yesterday and now they're returning with new symptoms, for example. Would that be a known or an unknown patient? You saw your patient yesterday and now they are returning.
Known patient.
Obviously known, isn't it, right? Because you saw them yesterday. Or in the cue card, it might say, this is your patient on the ward and they're having surgery tomorrow. Well, maybe you know them as well, okay? Now, often students get very worried about this, like, oh no, what if it's unknown? What if it's known? Don't worry. If you make a mistake, it's not actually that big a deal. Just be consistent in your performance in the exam, okay? What does that mean, guys? Be consistent. Be consistent. Anyone want to tell me what does Alan mean here? Put your hand up, Virginia, go on.
Yeah, if you start talking like as unknown and keep talking.
Yeah, right. If you make a mistake with known or unknown, just keep doing it like that. It's okay, right? Or unknown. So for example, just keep doing it. Don't say this. Hi there. Or hi there, John. Nice to see you again, John. Can I confirm your name, please? What's wrong with that?
A greeting with John and then ask his name again.
So if you've got his first name, that means you know him, you've seen him before. You're not going to confirm his name again, right? It means you saw him yesterday or even the same day. So just be consistent. Don't mix them up. Be consistent. Don't mix them, okay? Now, on Monday, I said for a home visit, we're always going to start with, what are we starting with in a home visit?
Thank you for inviting me.
For inviting me.
You can start with thank you if you want. Yeah, you can start with that. And then you're going to say what? Your name.
Introduction.
So, hi, my name's Alan. I'm one of the nurses in the local clinic. Okay. Then you're gonna confirm
Yes.
their name. Okay. Then you're gonna say thank you in a home visit. What did we say on Monday? So your name, confirm the name, say thank you. What else?
How are you feeling?
There is a
Context.
context.
And then what else?
Feeling.
Like how are you feeling?
Feeling.
Okay, so this is the basic thing that we do in a home visit when it's an unknown patient, unknown, okay? But very important here, guys, is this one, or let me focus on this one and this one. The blue, are they essential or not essential?
Essential.
Essential, right? I really think that you must do these 3 things. But is it essential to say thank you?
No.
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 But
Is it
it feels
essential to
good.
give context? Is it essential to give context? No.
No.
not
It's
necessarily.
it's very helpful sometimes, but you don't need to do it, right? So this is what we studied on Monday, like this. Hi, my name's Alan. I'm one of the nurses from your local GP clinic. Can I just confirm your name, please? Okay. And may I call you Jane? Fantastic. So thank you for inviting me into your home, Jane. I'm aware that you've been having problems recently with your medication. So how are you feeling at the moment? Okay, so that's what it's like. That's what we've been practicing this week. What about a clinic? Do I do exactly the same thing in a clinic?
Yes.
Yes.
Yes. Only
Except that
without thank.
We can ask what brings you here.
you can if you want. I'll talk about that in a minute, actually. You can say thank you in a clinic, can't you?
No, no.
Thank you
Maybe.
for coming.
Maybe, yes.
Thank you for coming in today.
Mhm.
Thank you for coming in. This one is thank you for inviting me into your home. Okay. Now, remember, we studied this on Monday. If you want to see more specific things about this, go and watch the class on Monday on the SET website. Okay, I'm just reviewing today. Okay, so we say thank you. Well, it's a different thank you. Also, someone said, what brings you, who said, what brings you here today? Who said that?
Me, Veronica.
Yeah, you could say what brings you here today. But if you say this one, Ronica,
Yeah.
you can't say that one. Okay, does that make
Okay.
sense?
Mm.
So you have to choose between them. You cannot have them both, right? I cannot say this. I'm aware that you've been having problems with your medication. So what brings you here today?
Mm.
It can sound a bit strange, a little bit strange, because if you know already, then why are you asking them? You know what I mean?
Yes.
Yeah.
You know what the problem is from the notes, then why are you asking them what brings them here? So it's just exclusive. You cannot have them both together, but that's okay, Veronica.
But it is an unknown patient, so we can ask them, no?
Well, we're not talking
what-
about, we'll talk about that in a minute. We're just talking about known, okay? What I was saying before, guys, is the essential ones are only these, right? So do I need to say thank you anyway? Do I need to give context? No, it's not essential. Okay, so you don't need to do it if you don't want to. All right. What about clinic now? We're just doing the unknown. I'll come back to the known in a second. What about clinic, guys? What do I do?
Your name, confirm patient.
Not clinic, hospital. What do I do in a hospital? Do I give my name? Do I say, hi, my name's Alan. I'm one of the nurses in this hospital.
Yes.
Yeah.
Yes.
Yes.
Do I say, can I confirm your name, please?
Yes.
Yes.
Definitely. Do I say, thank you for coming into my hospital?
No.
No.
No, thank you. Okay, because it's a bit strange to say that in a hospital. Can I say, I can see from your notes that you have surgery tomorrow?
It depends, yeah.
Yes. Depends
You
on.
can if you want, right? Yeah, it's not essential, but you can if you want. Should I say, how are you feeling today?
Yeah.
Yes.
Yeah.
Okay, so this is what we were studying on Monday. This is kind of what you do in a home, a clinic, or a hospital. Now, Ronica, if I know them already, do I need to give my name? Do I need to
No,
hi?
You
My-
can.
we can, but not essential.
Usually we don't, but you could Virginia say something like, "Hi, Alan," right? So you need to use their name, right? Hi, Alan. What's next? You could say, my name is Virginia, as you may remember.
Yeah,
As you
just
may remember.
Yeah.
to remind them. Maybe ask too much what they could remember.
So you could use that phrase, guys, if you want. It's not essential, but you might say, as you may remember, my name is Virginia. Okay, all right, so that's fine. What else do I need? Do I need context? Do I need to say thank you? What do I need, guys?
Context can.
Thank
Thank you for inviting.
Thank you.
Thank you
Contact.
for inviting me in your home.
How
I'm
are you
feeling.
Yeah.
So it's like this. I'll give you guys an example. So, hi, Virginia. As you may remember, my name's Alan. Thank you for inviting me into your home. I'm here today. This will be context, guys. I'm here today to discuss your diabetes. So how are you feeling at the moment?
Yeah, that's fine.
Now, remember, you don't need this one. You could just say, hi, Virginia. Thanks for inviting me into your home. I'm here today to discuss the diabetes issue you have. How are you feeling at the moment? Okay. So essential would be to use their name. and to basically say how you're feeling. But these are the only essential ones, really. Okay. What about in a clinic? What do I do in a clinic? Everyone, is it the same?
Same.
I would say the same.
Yes.
Yeah.
So if you could say in a clinic, "Hi, Veronica," right?
Right.
So how are you feeling today? You could just start like that, very simple.
Yeah.
Probably better would be, "Hi, Veronica," or Virginia. Thanks for coming in today. I'm aware that you're having problems at the moment with your medication. How are you feeling at the moment?
Yeah.
Okay. So this is the structure for this one. What about the last one? Let me ask Khalida.
Yes.
What do I do in the last one?
I think you have to introduce yourself because in hospital, yeah,
Not if it's
in
a
Not really. If you know, you don't have to.
yeah.
like
Khalida,
maybe you know the
go on, Khalida.
maybe you know the patient, but patient don't know you.
Yeah, so you could use this one. But what we're saying, Khalida, is sometimes in the card, it might say, imagine, for example, Khalida, it says, "This morning," right? This is in the card. "This morning you discussed the coming surgery." Okay, so do you know the patient or not if it says that?
Yeah, you know.
Yeah, no,
Yes, I know.
So
But
if you
it's-
discuss, if Khalida, if it was this morning, you can say, "As you may remember," or
you can't say like it's me again, like Khalida. How are you feeling?
you can just leave it, Khalida, right? When I speak to you in class, Khalida, do I say, "Hi, Khalida, as you may remember, my name's Alan"? No, I just say, "Hi, Khalida." That's what you do normally. So you can do it if you want, but don't get worried about this. It's just we're talking about some situations. It's very clear that you spoke to them recently. Okay. So you just have to be ready to do less. You just do less things. So we can use their name. We can say, "As you may remember," if you want, if you're not sure. What else, guys? What else can we do?
Then you can say I can say
Context how you feel.
Do I say thank you?
No.
No.
Context?
Yep.
Context.
So you might say, "Hi, Khalida. As you may remember, my name's Alan. I'm aware that you have surgery tomorrow. So how are you feeling?"
How are you feeling?
Okay. Now, should we be stopping, guys? Should I say, "Hi, Khalida"?
No. So we don't need to stop.
Do I need to wait for her to say,
No.
"Hi, Alan"?
No, you
No.
can
I think it's a bad
continue.
idea to wait because it's better. It sounds more kind of
Natural.
professional and natural if you just say it all really quickly. Does that make sense, guys? Like
Yes.
this, like this, like this. Listen to me. 3, 2, 1. "Hi, Khalida. Nice to see you again. As you may remember, my name's Alan, and I know that you have surgery tomorrow. So how are you feeling at the moment?" Just all really quick. All right. You sound professional. You sound fluent, and you're going to impress, I think, OET more. In my opinion, you'll impress OET more. Okay. So this is what we studied this week. You've had some sessions with Paul. You've had some sessions with Lawrence. And today we're just kind of finishing off, guys. I would like you guys to go into groups and just simply practice cue cards. Okay, so you can do a full cue card. It doesn't just have to be introductions now. And I just want you to, keep this in your mind that we are focusing on this. Okay, so does anyone have any questions before we go into groups? Does this make sense? I'm happy to take some questions if you want.
No.
Oh, it's
No,
all
thank you.
it's all perfect. Okay, so well, I'm going to ask you some questions quickly, but first, guys, I need to give you the link in the chat to allow you to choose your own cue cards today. You can choose any cards you want. The link is here. Guys, can you all just check this? Does it work, that link?
Yes.
So Khalida, it works. Virginia, working for you? Abigail? Is it loading? I know it takes a bit of time sometimes. What about Talal? We haven't really spoken very much Talal. Shashini, Sevinch?
Yes, it's
Yeah.
working.
Okay.
Yes, waking.
Yes, yes.
Yes, sir, it's working.
And remember, Hussein, I think you're here, or if you're a doctor, this is the nurses' room today. So just go to the website and make sure you click the right button. Finally, did anyone discuss other situations with you guys? Did anyone discuss that? Other situations? So, did Paul?
No.
Not sure if Paul did on Tuesday. Did Lawrence discuss it with you?
No,
Ah,
I
Not
didn't
really.
remember.
okay.
Yes.
Well, maybe at the end we can talk about
Maybe with Paul.
okay. Possibly with Paul you discussed, okay.
Yes.
Remember, there are other situations, like, for example, let me just quickly give examples. Like, what if you're in a school, you're a school nurse seeing a student? What should you say in that situation? Anyone?
Again, you can say your name. Maybe they don't know you.
Yeah,
Just
which one is most like this? Which one is the most similar?
Clinic.
Clinic.
cleaner.
Cleaner.
Guys, just use the clinic and maybe you can change it, Virginia, like you're saying, yeah?
Mm.
You could say, hi, my name is Virginia. I'm one of the nurses in this school.
School, yeah.
Can I just
Can you confirm your name? Just, yeah.
And you could context, guys, you can do like a school
Yeah.
context. What could we
If
say?
you know why they're coming, or if not, you
Yeah.
ask them.
Like, for example, I'm aware that you have exams coming and you're very stressed about your exams, right? So you can use these even if it's a different situation. You can just change it slightly. What do we do if there's two people? It's a baby and a mother. What should we
Yeah.
say?
You talk to the mother.
We usually would talk to the mother, or
And
we talk to one person, guys, in the exam because there's only two people in your exam. Okay. But how do I confirm the name if there's two people? What shall I say?
can I confirm
Yeah.
both of names,
Just
please?
there's different things you can say, but one easy way is just to say, can I confirm both your names, please?
Mhm.
Right. You can also say, guys, what about this? How are you both feeling? Right. What does both mean, guys?
That both persons which
Together, all
Yeah.
of you.
And guys, don't make this mistake. Sometimes students say this. Can I confirm your both names, please?
your names both. Yeah.
So let me just put this here, guys. So write this down, please, because this is
Both,
a common mistake. Okay, which one is correct? Can I confirm both your names or can I confirm your both names? Which one is correct?
Both your names.
Both your names.
Write it
Both
down. Both your.
First one.
Very easy to make a mistake here, right? So I'll just put this here so you can see this. Delete. Okay. This one is bad. There's another crazy situation sometimes we get. What about this? Okay. What if you start in the middle?
Yeah, I was thinking about it.
Has anyone seen cue cards where you start in the middle of consultation?
Yeah, I see.
Guys, don't worry about this. If you're starting in the middle of the conversation, Ahmed, what do we do? Amoki, Eda, Fatma, what should we do if we're starting in the middle of the conversation? With the cue card.
Just do context. No, straight away.
What do we think, guys? Is she right? Only context?
Because if you already, example, taking some blood pressure or something else, that means
Yeah. Now, Virginia, you're very good, but obviously some of these people are shy.
okay.
So, Patricia, come on, you can't hide here. Shashini, right? Can you say hello? Oh,
Sir.
yeah, hi, Shashini. So, look, when we say only context in the middle of a conversation, do you know what we mean by that?
Actually, I don't have idea, sir.
Yeah, this is important, guys. Look, so imagine, Shashini, you already took blood pressure and you are starting your OET exam and you already took the blood pressure. Can we say, hi, my name is Alan, I'm one of the nurses in this clinic and blah, 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 blah? No, because we already did that, okay? This test, this OET test, it's a reading test as well. It's a reading test. So Virginia's saying just context. So what context can I use here? What can I say? Blood pressure. Okay.
I just finished.
I already checked the blood
Just
pressure.
finished, right? So, okay, I just finished taking your blood pressure. It's normal, right? Whatever you need to say. So no names, okay? No introductions. Thank you, Virginia. I can see it's nice to have you here with such clear answers here. Are there any other problems? Other situations we might have difficulties with? I think that's mostly everything. You can have a different situation. You can have two people. You can have start in the middle. Is there anything else people are worried about for introducing yourself? I think that's mostly
So
it.
during the conversation, always may I need to call his or her name. Yeah.
Well, if you don't know them, you need to confirm the name, right? If you do know them, yes, always start with the name. I think probably is a good thing. Does that make sense?
Thank you.
Thank you for that question. Anyone else? Come on, guys, don't be shy.
Yes, Sir Alan, what if in the real exam during the speaking and about this regarding this situation you already in the middle of the situation, but then you started with introducing yourself and ask a patient's name. So what shall we do? Shall we continue what we have started?
Yes, Abigail. Now, and this is what I was saying before, guys. Look, if you make a mistake, Abigail, for example, you didn't realize and you introduce yourself, and then suddenly you realize, oh no, I'm starting in the middle. Don't stop. Just continue. You can still pass. You can still get a very good score. Okay, so they're not going to say, oh, fail. It's just a small thing, actually. The whole introduction is actually quite a small part of your grade. Okay.
Oh,
so
thank you.
what I don't want you to do, Abigail, or anyone, is if you feel, oh no, I made a mistake, don't think about it. Does anyone know that song, Let It Go? The famous song, Let It Go?
Yeah, Frozen.
Yeah. Yes.
Well, you just have to let it go. You just let it go. Okay, so I think here's one more, and I'll put you into groups after this. What if it's a very serious emergency situation? You're talking to someone and maybe their husband is very, very sick, dying. It's urgent. Do we need to do these things in that situation?
I think no.
Yeah, imagine.
No, you don't have time.
Imagine it's a baby. New baby is very sick, like might die, maybe dying.
First we need.
Oh, can I confirm your name, please?
No, you no time.
So in those situations, come on, you guys are nurses. What should you do? Just do
We
what
have
you
to show empathy.
We should reassure them.
Empathy.
reassure them.
Empathy. Empathize with them.
So in that situation, I would just be very, very loving, caring, reassuring. Just do that, and OET will, I promise, they will see what you're doing. Okay, this is a very practical test. They're not trying to just say, oh, always do the same thing in the same situation. Okay, so if it's very serious, I'll just put it here. Show empathy, reassure. Don't worry about anything else. Okay.
Make them comfortable.
Yeah, just like you would in real life, Veronica. What would you do in real life? Just do that, okay?
Make them comfortable.
Make them comfortable, reassure them, lots of empathy, all that kind of stuff. Okay, guys, so I want you now to go into groups, and you're going to have 30 minutes in the groups to share your screens and practice any cue cards. You don't only need to do introductions today. Today you can do everything, but just try to focus on this. When you're chatting to each other, when you're giving feedback, try to focus on introductions, okay? So the rooms are opening now. I'm going to open the rooms. Please, hopefully everyone has the link. Okay, so go into the rooms, choose a cue card and start practicing. Okay, there's going to be about 4 or 5 people in each room, so there should be enough people to share the screen. Any problems, just come back here and I'll wait here and I'll help you. Okay, but everyone please join now. All right, and if you're watching this on YouTube, we do classes like this all the time. We do speaking every day, Monday to Friday. Okay, but I'm going to say goodbye if you're watching